New York City Health Commissioner Dr. Ashwin Vasan. Good morning, Dr. Vasan. Thanks for being with us this morning.
Good morning. Thanks for having me.
Yeah, a lot of parents very eager to get these vaccines out. So is the City Health Department distributing both the Pfizer and Moderna vaccines at all of the sites, and do all the current sites have pediatric doses?
That's right. So there are two different vaccines for children 6 months to 5 years. One is from Pfizer. That's a 3-dose regimen. So the first 2 doses are separated by about 3 weeks, and then the last dose by 2 months. And then the Moderna vaccine, which is 2 doses separated by about a month. And so the city-run sites, that is run by the Department of Health, we're administering the Moderna vaccine. Across pediatricians' offices around the city, there may be a mix of availability depending on what they ordered. But we couldn't be more excited. We've been waiting 2.5 years for the ability to protect our littlest ones. I'm the father of a 3-year-old myself, and I can't wait to get them vaccinated as soon as possible. And so, we're ready and we're excited. It's a great day. We can protect our most vulnerable kids.
Well, Dr. Vasan, when can pediatricians expect their doses to be delivered?
They can get them right now. I mean, I think you saw that delivered through the clip you showed with Montefiore. As soon as the federal guidance came down from the CDC, clinicians are allowed to and ready to deliver those doses. So, they should be getting vaccine in as we speak. We're starting delivery at city-run sites, which are running for a limited time, about 2 months, just to really address that initial demand that we have seen with other vaccinations. But look, we're encouraging most parents to call their pediatrician first. We know how important that relationship is between a parent, a child, and a pediatrician. It's your trusted source of information and guidance. And so, I'll be calling my son's pediatrician, but I have no hesitation also going to one of our city-run sites to get that information as well. We also encourage parents to combine this visit. Get your kids up to date on their other vaccinations in preparation for the school year coming up. And it's a really great time, and we're ready to go.
Yeah, trust me, as a parent of 2 children, it's better to get them all done at once than to have to keep going back. As you mentioned just a few minutes ago, Pfizer has 3 doses, Moderna has 2. Now, adults were told that we can do both, like first shot do Pfizer, second shot do Moderna. Is it different for children?
Yeah, right now we're asking children to stick with the regimen that they started with. So if you started with Pfizer, continue on through Pfizer. If you start with Moderna, finish with Moderna. I think as we learn more about this vaccine and how it performs, and we collect a lot of data on how children are going to be doing after receiving the vaccine, we'll know more about whether there's an opportunity to mix and match as we did for the adult vaccinations. We also have to remember that those adult vaccinations came in at a time of real emergency when vaccine supplies were scarce, and everyone was trying to just get an initial level of protection. And so it's just a different time.
Listen, it's taken us 18 months to get to this point, when shots first started going into arms. What do you say to parents who are still on the fence about getting their children vaccinated, Doctor?
Look, I mean, I understand. I understand medical decisions for our babies, our most vulnerable babies, are always important ones, tough ones, and always maybe require that extra conversation or a few extra questions. So that's why we're saying call your pediatrician, get those questions answered, get that reassurance you need. This is a safe, effective vaccine. It protects against COVID, and it protects against COVID's severe complications like hospitalization and death. And so we know that this is an effective tool, but we also understand that parents need to have a dialogue, and they can have a dialogue with us at the city. They can get their questions answered when they call to make an appointment or at any of our city sites, but they can also call their pediatrician and get that from a trusted messenger as well.
Yeah, and these vaccine availabilities for children are just coming as the city moves its COVID risk level to medium. But what exactly does that mean? And do you hope this will remain this way, or at least go even lower through the summer?
Look, I'm very glad that we are moved down a risk level. As I've talked about at length before, that's based on a combination of factors: our case transmission rate, our hospitalization rate, as well as our capacity in our health system to absorb an influx of COVID patients. Look, this is the first wave of the 2 years we've had COVID, 2+ years, where we've seen a real break between cases and hospitalizations. And that's a really encouraging thing. We think that's due to, number one, a high level of vaccination that we have across the city. A lot of people have been infected in prior waves, especially during the winter. And for the first time, we've had treatment at scale available to people, and we've administered over 50,000 doses of treatment to the public. And so, we're learning a lot about how these variants are behaving, and it's teaching us a lot about what to prepare for the summer and the fall. We don't know what's to come. I think most experts, and I agree that we are probably in for another wave in the fall. But for now, I'm really glad we're in the right direction. I'm looking forward to a healthy and happy summer. And, I'm thankful to New Yorkers for continuing to take these steps to keep themselves and their communities safe.
Yeah, that's for sure. Well, Commissioner Vasan, we thank you so much for joining us and answering the questions I know so many parents and child caregivers are wondering this morning.
Anytime. Glad to be here.